Welcome to the show, Bobby. Good to see you again.
Good to see you, Larry.
When you hear holistic and elder care, how do those two things come together?
So what we try to do with our elderly population is manage their whole mind, body, and spirit. If you look at like a tree with the branches, we look at each individual branch of that person rather than compartmentalize their care. So if someone, for instance, has congestive heart failure, we're not only going to work on the treatment of that, maybe their husband just passed away and they also have a broken heart. So we'll deal with those issues. And we deal with them using both modern and traditional medicine.
It's also known as life care management, fully integrating all those things. It's a relatively new concept.
It is a new concept, and I'd kind of like to think that I started this concept in the Pittsburgh area to try to make aging for our Pittsburgh residents a gentler process, a more holistic, where we're looking at everything that's involved in their aging process, not just the medical components, but all their life-altering issues.
So let's talk about some of those things and how you kind of start the process of going through that and finding out who these individuals are.
So what life care management is it's when we help families, in a nutshell, manage the care of their aging relative, aging parent. And the way we do that is people will call upon us to do an assessment. Typically, they're in some type of crisis mode. And we look at several different areas. One of the things we could look at is, are they living in the best environment? Is the environment they're living in most conducive for them to age? And whatever that environment would be, their home, making sure it's a safe place for them to live and the supportive structures they need in order for that to happen. Or if the home is no longer a safe place, looking at alternatives, assisted livings, personal care homes, CCRCs, whatever happens to be available. We have expertise. I've been doing this for 35 years in the Pittsburgh area, so we know what's available, and then we also look at financial and legal things that need to be in place as you age. So we're working within whatever that person's budget may be to offer recommendations. If they qualify for any entitlement programs that are available in the Pittsburgh area, we'll get them on board with that. We maximize the use of their insurance, make sure they have the best insurance for what their specific individual needs are. The legal things, financial things that need to be in place. So powers of attorney, medical and financial powers of attorney, living will. Frequently, we always have on our assessments the conversation about end of life with people. You want to bring it up when end of life is not what's going to occur. So making sure they indicated they didn't want CPR. Do they even know what that means? Or they indicated they want it, and do they know what happens, physically happens when you choose that? So we will look at that and help families with that. And any other legal things that need to be in place, we would refer to elder law attorneys if they didn't have those things in place. We also look at any type of service that they may need of supportive structure to help them age in place. We offer, most of our care managers or nurses or have a medical license of some kind, licensed social workers or nurses. So one of the most conducive things to help someone age well is we act as that conduit between their transitions of care from hospital to wherever the next step is, if it's skilled or home or assisted living. And we assure that everything that transitions smoothly. We all have extensive case management backgrounds. Most of us have worked in case management for either an insurance company or a hospital, so we understand that. We also take them on doctor's appointments so that if the older person isn't understanding everything the physician is saying, we can help that process, and we can also communicate back to all their providers what type of services, what's happening in the home environment that frequently the physician is really not aware of. So we provide that whole, those are just some of the branches that we deal with.
It's highly emotional in many cases to gather this all together, but I could see what the benefit would be by doing so. So then you have a life care manager
Right.
who's dealing with each and every one of these issues.
And so we work very well with families. So family dynamics are, in every family you have dynamics to it that sometimes it's hard for the families to get past whatever the childhood dynamic is. So we can act, as a facilitator to make sure things that need to happen, acting as the experts for that family. And we really become a part of their family. They become, we become their daughters or their sons. And when something happens to one of our clients, it's very emotional for us. We are directly involved with that. So.
Holistic approach, life care management.
Yes, yes.
You do great work.
I love what I do. I have a passion for what I do.
I couldn't tell.
I love making the difference in that age group that, sometimes it's just pushed aside. Some of our most amazing clients are in their upper 90s.
And they're still in need of a lot of things that people, some cases, neglect.
They want a gentler approach to aging.
I'm for that, by the way.